Turkana County as one of the priority counties in Kenya for this maternal newborn project was actually based on the indicators. We all know that we have about 6 counties that contribute to almost 50% of the maternal mortality rates in Kenya. In partnership with the county government of Turkana, we're implementing the maternal newborn health project that is targeting to contribute to the SDG number 3 of improved health. We actually expect, as part of the short-term interventions, to have more and more mothers accessing skilled birth deliveries, and that would definitely be a result of a good antenatal care clinic attendance.
Tulifundisha maneno ya nyumbani pamoja na community. Kumwambia wamama ya community ile iko na mimba akuja hospitali, asalie hospitali. Usizalie nyumbani, kwa maana zamani alikuwa anasaa nyumbani na wengine hata alikuwa anakufa.
In Turkana, what we've done across the county is to work with the health facilities and ensure that we have a special arrangement which we call a maternal shelter. A maternal shelter in Turkana is actually a manyata, where mothers that are almost due for delivery come in to wait for the actual labor pains to begin. Most of the mothers you see coming to these maternal shelters are actually mothers that are almost 2 to 3 weeks due, and they feel that the distance would hinder them from quick access to skilled delivery. We have mothers coming as far as 50 kilometers to come to this maternal shelter. So when they come in, we see a lot of engagement, because before the mother is released from her home, the husband normally gives consent. So we use the trained community health volunteers to ensure that the husbands are actually engaged, they have given consent.
Hapa awali sisi hatukuwa tunajua hospitali ni nini, lakini ilifika mahali tukaanza kupokea madaktari ya kijiji au wenye wanaitwa CHVs. Sasa hao ndio madaktari ambaye walitufunza kuhusu kitu inaitwa hospitali, kwa sababu pale hatukuwa tunajua wamama huwa wanaenda kujifungulia kwa hospitali. Lakini wakati hao ma CHV walianza kuingia vijijini huko, waliweza kuchanua sisi wasee wa raia.
So juzi vile tumeleta hiyo education, saa hii wanafurahia. Mtu tu mwanaume akuona bibi yake hapo na hiyo pain kwa tumbo ama bleeding, anasema tu peleka hospitali. Hata ananipatia mimi report ya kuwa peleka hii mama kwa hospitali, ni ya kiji yako.
In a shelter you find that at one particular time we have 2 to 3 mothers in the maternal shelter. We actually have them coming in, staying in, and on a regular basis we have arranged that the health personnel comes in to check on their progress. So
actually we are really proud for our CHVs, training supported by the partner, that was the World Vision. We trained all of them, the 3 units, and the linkage is actually strengthened well. And my deliveries since training, skilled deliveries have gone up. At this facility, at every time, our target is 36. And we even go surpass the target to 40 per month.
We have not been able to document the high-level impact, but you can actually see the trend of the hospital deliveries increasing, and we celebrate with the mothers. And in fact, as a result, you actually see that more and more mothers are giving birth safely. We've seen a lot of reduced complications around the neonatal period, because then even after delivery, they can actually be followed up by the same community health volunteers to ensure that their babies and even the mother is okay. Because I think we all know that neonatal death is also an alarming thing for us, with about 20 out of 100 life births.
Nashukuru Mungu sababu nimejifungua vizuri na namrudishia shukrani.
I want to extend our appreciation to the county government of Turkana. all the other partners that are working in Turkana, because we've collaboratively been able to work. We also want to appreciate UNICEF, DFID, and of course just appreciating World Vision as the implementing organization.